Dr Abdisalan Noor, the lead author of the WHO's World Malaria Report. Thank you very much indeed for joining us and welcome to the program.
Thank you. Thank you very much, Peter.
It's been a year since we last spoke to the WHO, particularly around malaria, the global report. I'm just wondering if you can take us through the key findings of the 2021 report. And I'm thinking that COVID-19 played a major part.
Yes, indeed. The major finding of the 2021 report, which presents the results all the way to 2020, shows that the disruptions during the COVID-19 pandemic has led to an additional 14 million cases of malaria and an additional 47,000 deaths due to malaria between 2019 and 2020. And of course, these disruptions, even though many of them will be related to the pandemic, we know that particularly in Sub-Saharan Africa, where most of these increases are happening, there are other things that have also been happening, such as conflict, flooding, the Ebola outbreaks, and other humanitarian emergencies.
How did the COVID pandemic disrupt the normal happening?
I think there are a few ways in which the pandemic disrupted services. The first one is the restrictions on movement and the lockdowns meant that people either could not access services or were afraid to go to the health facilities. And so if you're sick and you're not getting treatment, then you're likely to develop severe disease and potentially die of malaria. The second way it disrupted was the prevention interventions, such as the distributions of insecticide-treated bed nets, spraying of houses with insecticides, distribution of chemo prevention in communities during the high transmission season. And all of this require contact with communities. And during the pandemic, there were concerns that this might lead to transmission of COVID itself. And so it took a while for countries to get in place protective equipment to help with the implementation of these malaria services. And of course, the third way it disrupts is the overall growth. The cost of commodities has gone up. An investment that you had planned to buy a certain number of commodities previously buys you less this time, and the cost of transportation to the countries and within the countries also went up. So in this way, the disruption affected malaria services.
The pandemic is not over. Vaccination levels, particularly in our region, Africa, are still very low. Does that mean that you're fearful that this will further disrupt the fight against malaria on the continent?
We're really concerned. Although countries have really been impressive in the way they have adapted during the pandemic to implement malaria prevention and treatment, we are concerned. And like everyone else, we would like rapid vaccination of malaria endemic countries' populations. With the emerging variants and other complexities, we are not out of the woods at all. And, disruptions as well. And disruptions of government's abilities to invest in healthcare.
All right, let's take a look a little bit about the way that you count deaths in children under the age of 5. I believe that there was a new way of doing the sampling and the statistics, and that's painted a very different picture over the long term. What has been the real picture then? So,
what the new methods, which are essentially better statistical methods and updated data to inform those methods, show that, and this is really affects Sub-Saharan Africa in particular, that the toll that malaria took on children under 5 is a lot higher than we had originally estimated. And so while previously we'll be talking about, in the recent years, about 400,000 deaths due to malaria, about 70% of those due to children under 5. Now we're talking about over 600,000, and 80% of those are in children under 5. And overall, 95% of all the deaths occur in Sub-Saharan. The estimation but we are confident that this is closer to the reality, despite the fact that they are all estimates and have uncertainty in them.
Even before the COVID-19 pandemic, the fight against malaria, the progress we saw had sort of plateaued. What had caused that, and what kind of interventions are required on top of dealing with COVID-19?
So you're absolutely right, particularly in, again, Sub-Saharan Africa, again, in the highest burden countries. The progress against malaria had stalled or slowed down, and in some cases reversed even before the pandemic. The pandemic complicates things further and makes things a lot more difficult. What we need to do is a number of things. We need more resources, of course, at a time when economies are suffering. We need better way of implementing our strategies and delivering services to communities in a much more efficient way that maximizes on our investments. And we need a greater country leadership, and countries own the process and step up and really lead the charge, with the external partners giving them the space they need to allow for that dynamic response that's particularly necessary given all the issues related to responding during the pandemic. And finally, communities, engaging communities and making them part of the response, whether it's malaria or the pandemic, is really, really essential.
Progress around the world remains uneven. A country like China, that's got a population bigger than the entire continent of Africa, ending malaria, and yet our continent is struggling. Why is that? Why are some regions struggling much more than others in terms of making progress?
First of all, congratulations to China for such an excellent achievement, including as well another much smaller country, El Salvador, certified malaria-free in 2021. One of the things that differentiates is two things. A, the role that development, socioeconomic development, infrastructure development plays in modifying the environment in which malaria breeds, and the ability of people to seek prompt care and the awareness of people in the prevention of malaria. And so that really is a big part of the gains against malaria, and people should not forget that we need that level of development to impact not just on malaria, but also on a large number of other diseases. Second, the Chinese government mounted a really efficient, largely locally funded process. And that is what we need to learn from in Africa. And we need greater country ownership and greater country leadership in the response to malaria. We will still need a considerable external support and resources in that fight.
Are the tools available to us in terms of fighting malaria improving over time? Are we putting more and more tools on the ground?
We do have tools that can get us to very low levels of malaria. We do have tools that literally get rid of malaria deaths, because now we have highly efficacious drugs, and if promptly treated, you shouldn't die of malaria. What we don't have, and we've just announced the vaccine, which has an impact on averting a lot of deaths, but it's not the magic bullet. It's got to be used in addition with other interventions for the collective impact. However, what we don't have are the tools to eradicate malaria in Africa. And this is where significant investment in research and development and innovation is required.
You mentioned China's commitment to eradicating malaria and their investment in dealing with the problem. Do you think that we're doing the same in Africa, that our political leaders, our governments are investing enough? Is there enough political will? Or is it that maybe resources are what's a challenge for us?
I think the data on domestic investment remains fairly stable and similar to where we were 10 years ago, so there's no major change there. And overall investment in malaria also has been fairly similar over the last 10 years. I think there are two things in terms of what the role of countries. The first one is, of course, resourcing, and there's need to as much as possible, given all the other priorities and the challenges in the economies for countries to continue prioritizing the investment in malaria from domestic resources. But there's also an even more critical thing that they need to do, which is really lead the fight. Mm. And by that, I mean, given that at the moment in Sub-Saharan Africa, malaria is still largely externally funded, there's a bit of a tendency for governments to delegate the real charge, the thinking, the responsibilities, the dynamism to the donors who are funding the process and the partners who are implementing that. And that's why I think that the real leadership in ensuring efficient delivery of services requires quite a bit more improvement.
The Malaria Report 2021 to 2020, what's your overall feeling about where we are now? Yes, COVID has happened, but the fact of the matter is people are still dying of malaria. How are you feeling about where we are?
You know, I'm usually a very optimistic person. I first have to congratulate the countries in averting what we had originally projected will be a doubling of malaria deaths if services were severely disrupted. In the end, particularly in Sub-Saharan Africa, in the end, we've seen a 12% increase. Still considerable, but far better than where we thought we would be. So congratulations to the countries and the partners who achieved this. The second part is, I'm concerned, of course, we're still having unacceptably high levels of malaria disease, but we have the tools. We just need to put in the effort. We need to increase the resource envelope. We need to increase the efficiencies. We need to increase the equity. And we just need to be better at the job. And I'm optimistic with those that in place, we will be able to reverse some of the upward trends we've seen recently.
That perhaps answers my final question in part. And the question really is, what needs to be done to reach your global malaria targets? I believe we're looking at, a 90% reduction in incidence and mortality by 2030. That's not too far away.
It's not too far away. And at the current trends, we will be way further from that target than we are from the 2020 targets currently. What needs to be done, clearly highlighted in the report with regards to better context-specific intervention, better efficiencies in delivery of services. A lot of these gains depend on the resilience and the performance of the health system. A malaria-specific issue, it's a cross-cutting issue and highlighted in a really clear way by the COVID-19 pandemic. That needs significant improvements. We will need significantly more resources. The resourcing for malaria right now is below 50% for 2020. And we need to triple what we've invested now to get to the 2030 resourcing targets. And finally, we need more tools. We need better tools. We need innovation and investment in innovation. And I think, and we must not ignore the role that socioeconomic development outside of the malaria space really plays in averting the malaria burden.
Dr. Abdisalan Noor, the lead author of the WHO's World Malaria Report 2021. Thank you very, very much indeed for joining us on the program.